Welcome again to this health corner of Ardua Veritatem. At the last episode, I started with diabetes mellitus and talked about its meaning and its burden. Today, I'll be talking about the classification and risk factors of diabetes mellitus. Classification of diabetes mellitus. There are three common types of diabetes mellitus, namely type 1 diabetes mellitus, type 2 diabetes mellitus, gestational diabetes mellitus, and then other types caused by various defects. Type 1 diabetes mellitus, formerly referred to as insulin-dependent diabetes mellitus, can be immune-mediated or idiopathic. In immune-mediated type 1 diabetes mellitus, there is autoimmune destruction, that is, self-immunity destruction of the beta cells of the pancreas. It accounts for 5 to 10% of those with diabetes. This subtype of diabetes commonly occurs in childhood and adolescence, but can occur at any age. In idiopathic diabetes, there are no known causes of this form of diabetes, and it is strongly inherited. Type 2 diabetes mellitus, also referred to as non-insulin dependent diabetes mellitus or adult onset diabetes, accounts for 90 to 95% of those with diabetes, meaning that it is the most common type of diabetes. Type 2 diabetes mellitus involves insulin resistance and a relative insulin deficiency. Most patients with this form of diabetes are obese, and obesity itself causes some level of insulin resistance. Gestational diabetes, as the name implies, it is diabetes mellitus in pregnancy. This type of diabetes is as a result of any degree of glucose intolerance with the onset of first recognition during pregnancy. Simply, this is diabetes first noticed while pregnant or started while pregnant. Other types of diabetes mellitus include diabetes caused by genetic defects of the beta cells, that is, genetic defects in the cells from which insulin is produced. This type of diabetes occurs at an early age, generally before 25 years. This is referred to as maturity onset diabetes of the young, characterized by an impaired insulin secretion, a problem with the secretion of insulin with little or no problem in the action of insulin. Diabetes caused by genetic defects in insulin action found in diseases such as polycystic ovarian syndrome, leprechaunism, etc. Diseases of the exocrine pancreas, which involve any process that extensively injures the pancreas and eventually causes diabetes. These processes include pancreatitis, trauma, infection, pancreatectomy, which is the surgical removal of the pancreas, pancreatic cancer, cystic fibrosis, etc. Endocrinopathies, which involve excess amounts of hormones that oppose the action of insulin, hormones like growth hormone, cortisol, glucagon, epinephrine, leading to diabetes. Examples of such diseases are acromegaly, Cushing's syndrome, glucagonoma, pheochromocytoma. Drug or chemical-induced diabetes. Many drugs can cause a problem in the secretion of insulin. On their own, such drugs may not cause diabetes, but they may cause individuals with insulin resistance to develop diabetes. Examples are nicotinic acid and glucocorticoids. Some viruses, for example, Coxsackie virus B, cytomegalovirus, adenovirus, and mumps, cause beta cell destruction, thereby leading to diabetes. The risk factors of diabetes. 1. Family history. Having a parent or sibling who has diabetes increases the chances of developing diabetes. 2. Obesity or being overweight increases a person's likelihood of having diabetes. 3. Impaired glucose intolerance or prediabetes. States of having an abnormally high blood glucose or sugar level, but not up to the level to be diagnosed as diabetic. An individual with prediabetes is at risk of developing diabetes. Sedentary lifestyle, a life of reduced physical activity or precisely exercise of less than 3 times a week. Some ethnic backgrounds are more prone to diabetes mellitus, like the Hispanic and Latino Americans, African Americans, Asian Americans, etc. There is an increased risk of diabetes for people who are older and above 45 years, especially if they are overweight. Having gestational diabetes, that is diabetes during pregnancy, increases the chance of having diabetes afterwards in life. Some women who have the disease called polycystic ovarian disease are more prone to having diabetes. Unhealthy dietary habits are also linked to developing diabetes. Diabetes mellitus is a chronic disease that affects many organs of the body, and the most common type is type 2 diabetes mellitus. On our next episode, I'll be talking more about diabetes, its signs and symptoms, as well as complications. Bye.